Thank you everyone for joining us today. My name is Ariel Delaney. I'm the Executive Administrative Consultant with Rotary Malaria Partners. This webinar is part of an ongoing series which aims to engage both Rotarians and the malaria prevention community on unique topics of interest made accessible to everyone. The mission of Rotary Malaria Partners and Rotarians Against Malaria is to engage the Rotarians around the world in the fight to eliminate malaria. I'll now hand over to RMP's board chair, Jeff Pritchard, who will be introducing today's panelists for the event today.
Well, thank you, Ariel. It's good to be here. Both Rotary Malaria Partners and Rotarians Against Malaria Global are honored to present today's webinar. As Ariel said, the mission of both organizations is to engage Rotarians around the globe in the fight to eliminate malaria. In addition to its Rotary advocacy work, Rotary Malaria Partners is in various stages of training and equipping over 1,700 malaria preventative community health workers in Zambia and Uganda in conjunction with their respective ministries of health. RMP is also supporting malaria public education in the Gambia, indoor residual spraying in Ghana, among other projects. Separately, Rotarians Against Malaria is a Rotary International affiliate that has partnered with the Alliance for Malaria Prevention, providing comprehensive training for malaria intervention programs in all 20 sub-Saharan African nations. You know, we had originally intended to bring together the global malaria prevention community in a one-day malaria symposium in early June at the Rotary International Convention in Hawaii. Obviously, COVID-19 interceded. With the unfortunate necessity of canceling that venue, we asked our symposium participants to bring their knowledge and insight to the malaria prevention community in a different format, virtually via these webinars and videos. And today's presenters graciously agreed to do so. Our sponsors for today's webinar include UNICEF, the UN Foundation, Pilgrim Africa, the Juniper Foundation, State Farm Insurance, and the Rotary Club of Long Beach, California. And we sincerely appreciate their financial support for this program. Today's webinar is entitled COVID-19 and the Fight to End Malaria, with 3 representatives from the UN Foundation. Our first panelist is Tara Bracken. Tara is the Malaria Advocacy and Communications Officer on the Global Health Team at the United Nations Foundation. She completed her doctorate in infectious diseases at the University of Georgia Center for Tropical and Emerging Global Diseases, specializing in immunology and pathogenesis of malaria during pregnancy. Prior to the UN Foundation, Tara aided communications and advocacy efforts around the vaccine hesitancy and neglected tropical diseases at the Sabin Vaccine Institute. Our second panelist is Elizabeth Ivanovich. Elizabeth is the Director of Global Health for the United Nations Foundation. Before joining the UN Foundation, Elizabeth worked as a malaria monitoring and evaluation specialist on the USAID-funded Measure Evaluation Project. Earlier in her career, she also served as a Peace Corps volunteer in El Salvador, focusing on rural health and sanitation. Elizabeth holds a master's degree in public health from the University of North Carolina, Chapel Hill. And finally, Margaret Reilly McDonald. Margaret is the Executive Director of the United Nations Foundation's Nothing But Nets campaign. Margaret oversees the campaign's work from resource mobilization and programmatic grants to building strong synergies with the UN partners and the global malaria community. Before joining Nothing But Nets, Margaret worked with UNICEF in Botswana to develop media and civil society engagement strategies to further children's rights within the context of the HIV epidemic. She has a master's in public policy with a focus on global health from George Mason University. I'll now turn the webinar over to Margaret, Elizabeth, and Tara to explain how COVID-19 may seriously impact malaria elimination efforts.
Hi there. I'd like to thank the organizers for inviting us to come and speak with you all today. As Jeff mentioned, I'm Tara Bracken, and I'm on the Global Malaria team at the United Nations Foundation. I'm going to start the webinar off today by giving you some context on how the COVID-19 pandemic can impact the fight against malaria. As you've undoubtedly heard by now, the COVID-19 pandemic has reached nearly all countries, including those bearing the heaviest burden of malaria. This is a serious problem, not just because a deadly respiratory virus is spreading across the globe, but also because of the ways this pandemic could impact our ability to fight existing health threats like malaria. First, outbreaks and pandemics place incredible strain on already weak health systems, with impacts that can be felt across all areas of health. Second, infectious diseases like malaria, TB, measles, HIV, they don't just disappear when there's a pandemic. Everything that was already putting people's health at risk in high burden settings continue to be there, but now healthcare workers also have to battle all of these deadly diseases on top of new and emerging threats like COVID. Even during unprecedented times like those we currently find ourselves in, malaria transmission continues. The rainy season still comes and increases the number of mosquitoes that transmit malaria, particularly if shortages in resources, tools, and manpower critical for vector control efforts are disrupted by the pandemic. Mosquitoes in malaria endemic areas ignore social distancing guidelines and will continue to take blood meals. Anyone they bite is still at risk of dying if they're unlucky enough to become infected with malaria, and may actually be placed at further risk if they aren't able to access life-saving treatment if health facilities are overwhelmed due to the pandemic, or if they avoid health facilities because they're afraid of becoming infected. Third, in addition to their role in the fight against malaria, healthcare workers on the front lines of malaria elimination are also vital in the fight against outbreaks like COVID-19. This central role in diagnosing and treating patients also makes them some of the most vulnerable groups to these diseases during outbreaks. For example, during the 2014 to 2016 Ebola outbreak in West Africa, healthcare workers were between 21 to 32 times more likely to become infected than other members of the public in affected communities. Fourth, diseases don't respect borders. As the world shrinks with increased travel and mobility, COVID-19 has shown us all just how quickly and easily diseases can spread. So for example, the socioeconomic and political crisis in Venezuela has caused a huge upsurge in malaria cases. There was an estimated 1 million new cases in just 2018. And that was before the added stress of COVID-19 on health systems. So this can undo years of progress in battling malaria, both in Venezuela, but also in neighboring countries, many of which are approaching elimination targets. Health systems everywhere need adequate and consistent funding in order to respond to both malaria outbreaks and outbreaks like COVID-19. And lastly, the pandemic is causing issues in obtaining important tools in our fight against malaria. So for example, though pharmaceutical production is expected to continue through the lockdown period in India, capacity will be reduced due to manpower and increasing logistical constraints. And this is going to lead to delays in production of malaria treatments over the upcoming months. Likewise, we anticipate similar delays in the production of pyrethroid-based and PBO mosquito nets due to the closure of production sites in India and further tightening of production in Vietnam. We're also seeing similar supply constraints emerging for diagnostics, including rapid diagnostic tests, and disrupted global supply networks have resulted in some reduced ocean freight capacity, causing freight costs and therefore the cost of delivery of some malaria services to increase. So this is still an ongoing situation, and we're learning more about its impacts every single day. But we do have past experience from previous outbreaks that have already revealed to us the disruptive effects of health emergencies on health service delivery and the potentially devastating impacts for existing diseases like malaria. Again, to come back to the 2014 to 2016 Ebola outbreak in Guinea, Liberia, and Sierra Leone, this outbreak debilitated healthcare systems of affected countries and greatly undermined malaria control efforts, which led to a massive increase in malaria illness and death in those three nations. A study from the CDC done after the fact estimated that between the strain on health systems and patients being too afraid to seek healthcare because they were afraid of contracting Ebola, there was about a 50% reduction in healthcare services in West Africa during the Ebola outbreak. So this graph actually shows the impact this had on malaria in the region. So the suspected number of malaria cases reported fell way below previous years following the third wave of the outbreak. And this is kind of counterintuitive, but this isn't because there was less malaria that year. It's actually just because infected people weren't interacting with the health system, and so those cases were never reported. So as a result, as unprecedentedly catastrophic as the Ebola outbreak was at the time, it's estimated that indirect repercussions of the outbreak may have been even greater than the deaths directly attributable to it, with conservative estimates seeing at least 6,800 additional malaria deaths among children under the age of 5 alone. So in short, pandemics and outbreaks make it much more difficult for people to access healthcare services for other deadly diseases. So what could this reduced ability to access healthcare mean for malaria during this specific pandemic? A new modeling analysis by the WHO and partners sought to answer that question. It considered 9 different scenarios for potential disruptions in access to core malaria control tools during the pandemic in 41 malaria endemic countries, and the resulting increase in cases and deaths that may be seen if these scenarios actually play out. So in all of these scenarios, none of the mass insecticide treated net or ITN campaigns scheduled for 2020 are implemented. On top of that, the first 3 scenarios considered what would happen if continuous ITN distributions were also reduced by varying amounts, but access to effective malaria treatment stayed at levels we'd expect under normal circumstances. The next 3 scenarios flipped those conditions. So we still had no ITN campaigns, continuous ITN distribution stayed the same, but then access to effective anti-malarial treatment was reduced to varying degrees. And the last 3 scenarios look at what would happen if both of those services were reduced to varying amounts. So in the worst case scenario, which you can see on the far right side of this graph, scenario 9, all ITN campaigns are suspended for 2020, and both continuous ITN distribution and access to effective anti-malarial treatment are reduced by 75%. In that scenario, the estimated number of malaria cases in sub-Saharan Africa increases by about 23%, and the number of malaria deaths in the region doubles. About 70% of all of these deaths are among kids under the age of 5. So to give you some absolute numbers to go along with those percentages, because they're pretty extreme, the number of cases in sub-Saharan Africa under these scenarios, or under this worst case scenario, would increase by about 46 million, and the deaths would reach over 768,000. So this is double the number of malaria deaths reported in 2018, and it represents a return to malaria mortality levels even higher than those seen last in 2000, so before the modern era of global health, and we've had a lot of really significant progress against malaria. So 2 important things to keep in mind about this analysis. First, these modeling scenarios didn't account for a few other really key components to the fight against malaria. So this includes the impact of disrupting seasonal malaria chemoprevention and indoor residual spraying. It also doesn't consider disruptions to the global malaria commodity supply chains, which would interfere with access to treatments, diagnostic tools, nets, things like that. Second, part of the reason the impacts of this scenario are so severe is actually partly due to bad timing. So unfortunately, 26 countries in sub-Saharan Africa are due for mass ITM campaigns this year, which means that the suspension of these campaigns would have a huge and widespread impact across the region. So as you can see, even in this worst case scenario, the countries with no ITN campaign scheduled for this year were impacted less than those that did. And actually, they further found that in those countries that did not have an ITM campaign scheduled for this year, even about a 25% disruption in access to continuous ITN distribution and effective anti-malarial treatment didn't really cause any sort of increase in malaria cases or deaths. So what this tells us is that continuation of these mass ITN campaigns is really, really important to keep malaria under control during this pandemic. So all of this to say, it's absolutely critical that malaria endemic countries minimize disruptions to malaria prevention and treatment during the COVID-19 response, as failure to do so could lead to catastrophic loss of life. So I'm going to finish my section of the webinar by describing the WHO Solidarity Trial. Solidarity is an international clinical trial launched by the WHO and partners to help find an effective treatment for COVID-19. It's comparing 4 treatment options against standard of care to assess their relative effectiveness against COVID-19, and that includes the malaria drugs chloroquine and hydroxychloroquine that have been in the news a lot recently. This trial aims to be about 80% faster than traditional clinical trials, and it's doing this by providing simplified procedures to enable even overwhelmed and overloaded hospitals to participate, and by enrolling patients in randomized clinical trials around the world simultaneously. So as of the most recent count, more than 100 countries were working together on this trial. So until there's sufficient evidence, WHO cautions against any physicians or medical associations recommending or administering these unproven treatments to patients with COVID-19, and they especially recommend against people self-medicating. However, in the US, remdesivir, which is an antiviral that was previously found to be safe but ineffective in some Ebola clinical trials, it showed some promise in early trials, and so the US FDA recently gave it emergency approval as a COVID-19 treatment in the US. Again, the WHO has not commented on any of the treatments and will not do so until the trial is over and the results have been published. So that's a little bit of background on the current situation and how COVID-19 can impact the fight against malaria. I'm now going to hand it over to Elizabeth to tell you a little bit more about how the global malaria community is responding to this pandemic.
Thanks, Tara. And I'll start by reiterating what you said, that the modeled estimates of possible increases in malaria due to COVID-19 do not have to come to fruition. We have a really short window of opportunity to act and ensure that essential services for malaria continue. WHO has provided guidance to continue essential services during the pandemic with adaptations to minimize the risk. This guidance encourages programs to continue malaria case management, including diagnosis and treatment, both in health facilities and at the community level, to deliver vector control like bed nets and household spraying, and preventive malaria treatment like seasonal malaria chemo prevention. Also to adapt health messages to incorporate safe physical distancing guidelines, to order malaria commodities like bed nets, medications, and diagnostic tools, which Tara talked a little bit about some of the supply issues, with greater lead time to mitigate those issues and shipping delays. And to take special care to protect the health and safety of health workers, because we all know how important having health workers available is. And in many of the countries where there is malaria, there are fewer health personnel per capita. So protecting each and every one of those health workers, staff, and then also patients is really important. And the way that that can be done, for example, is by delivering bed nets in mass campaigns door to door, and therefore contact free rather than at central distribution points as has been done for years. Some services have been deemed non-essential during this time, as they should be. This includes surveys and certain kinds of monitoring. Those will be put on hold to reduce the risk of transmission of COVID and to help focus the resources where they're needed the most. Just to underline the point, the head of the WHO Global Malaria Program, Pedro Alonso, has clearly stated that countries should not scale back planned malaria prevention, diagnostic, and treatment activities, and that if someone living in a place with malaria develops a fever, he or she should seek diagnosis and care as soon as possible. And this is really important because COVID and malaria have some similar symptoms, and therefore staying at home, for example, if you have these symptoms, could really be of detriment to people who actually have malaria and don't have COVID. In order to enable malaria programs to continue essential service delivery, the malaria community has worked quickly and effectively to mitigate the challenge. This has included the release of this modeling exercise to predict the effects of COVID on malaria deaths, which was covered by Tara, as well as regular mapping of possible delays and risk to on-time delivery of interventions. It has also included the development of new guidance for net distribution, seasonal malaria chemo prevention, and social behavior change to allow for physical distancing. Many partners, including the RBM Partnership to End Malaria and the Global Fund to Fight AIDS, TB, and Malaria, are working to ensure that we have sufficient resources to fill the gaps of adapted programs, which are more expensive, including the cost of personal protective equipment for health workers. There have also been efforts to address these supply challenges that Tara covered. Finally, there's been work to adapt messaging for malaria and ensure that COVID doesn't discourage care seeking. This has been critical because initially people in sub-Saharan Africa were being encouraged to stay home if they had symptoms like a fever. And that is not acceptable behavior if you're trying to get cured from malaria. In many of these areas of response, Global Fund has been a real leader. They have provided up to $1 billion and operational flexibility to help countries fight COVID-19, shore up health systems, and mitigate impacts on HIV, TB, and malaria programs. Funding has been approved for 83 countries so far out of this $1 billion and 6 regional grants, and that total has gotten now to 138 million. There's the expectation that that will increase over time, and it's already increased since I put this slide together on May 1st. More than half of all the countries that implement Global Fund grants are now using these flexibilities. And this, along with the President's Malaria Initiative support to countries, has meant that there have been very few identified funding gaps for malaria at this point. However, we do expect to see shortfalls in non-eligible countries and further down the road. The Global Fund is also a founding partner of the Access to COVID-19 Tools Accelerator, also known as the ACT Accelerator, which is a global collaboration of organizations and governments working to accelerate the development, production, and equitable access to new COVID-19 technologies. They are a co-convener of both the Diagnostics Partnership, the Health Systems Connector, and are a procurement and deployment partner of the Therapeutics Partnership. They also co-lead the WHO Diagnostics Consortium along with UNICEF to negotiate pricing and procure diagnostic tests for COVID-19. And they've opened their innovative online sourcing portal to all countries and organizations so they can benefit from Global Fund's economies of scale for health products. So I'll just say, part of the reason that I'm giving so much emphasis to the Global Fund is that Global Fund is the largest international donor for malaria in the world. Last year they had their replenishment and were able to bring in $14 billion. So this $1 billion is coming actually from previous funds and will not affect that $14 billion, which is intended for the 3 diseases. I also recognize this is really a place where Nothing But Nets, UN Foundation, and Rotary have kind of joined forces in terms of our advocacy and support for the Global Fund. And I'll turn it over to my colleague, Margaret, to talk a little bit more about that.
Wonderful. Thanks so much, Elizabeth. And thanks again for having us. I'm a huge and long admirer of Rotary. I actually helped to broker some collaboration when I used to work at the One campaign with Rotary to do some joint advocacy work around access to childhood immunization. So it's great to be with you all. And I've loved working with Drake and Jim Moore and others, but excited about this conversation. Hope that it can be a launch pad for more partnership and collaboration moving forward. So Tara and Elizabeth have laid out, fantastic context. I think hopefully helps to set the stage for now what. So we know there's really difficult potential scenario that could come out of COVID in terms of the impact on malaria, but what can we do about it? And what can Rotarians do about it? What can Nothing But Nuts champions and supporters of UNF do about it? And how can we potentially work together, which is what I'm excited about. So one, just to start with sort of the obvious, which is, continue to provide the critical support that you're providing to malaria programs. So I know that Rotary has been a key player, whether it's in Zambia and their elimination efforts or in Venezuela, reaching hard to reach communities. And so obviously continue to do the work that you're doing, because as we've heard, this is not the time to take your foot off the gas pedal. Our support is needed more than ever. Next, there will be new challenges that are being faced in light of COVID and new gaps that arise due to funding restraints, prioritization, et cetera. And so as Rotary has done, and as we like to do in terms of filling gaps and reaching the most vulnerable key populations that may slip through the cracks of some of the bigger programs, we would love, for Rotarians to continue to doing that critical gap filling work. And while the Global Fund has been fantastic in stepping into a lot of that space, in the near term, we anticipate, and Elizabeth's on a working group, working in close collaboration with WHO to identify where there will be gaps moving forward. So we hope we can count on Rotary to continue to play that critical role. Advocacy for the Global Fund and PMI, and I'll jump into that a little bit more. But as Elizabeth mentioned, we know Rotary had made a tremendous $12 million commitment in the lead up to the Global Fund replenishment, with a focus on work in Melanesia and the Asia Pacific region. So kudos for your support of the Global Fund, and obviously it's more critical than ever. Next, taking a holistic approach to what's needed. So actually, ironically, despite our name, Nothing But Nets, we do more than nets. Nets continue to be sort of our bread and butter, but we do more than that in terms of covering diagnostics and treatment, training of community health workers. And now we need, we and Rotary needs to demonstrate the greatest degree of flexibility to really provide and fill gaps for what's most needed to reach the most vulnerable communities in light of COVID and who are most susceptible to malaria. And really working with partners to ensure that health workers are properly equipped. So I know we're really proud that both Nothing But Nets and UN Foundation and Rotary are co-founder or co-supporters of the Alliance for Malaria Prevention, which has been incredible in this COVID crisis, and that they very quickly adapted guidelines when it came to LIN or ITN distributions to ensure that programs continue, because of course, as we said, very worried that net distributions and IRS programs would not go forward because of social distancing protocols. And so fantastic that together we've supported the adaptation of some of that guidance to ensure these programs can continue safely in advance of the rainy season. So already working together on that front, which is fantastic. Also, one thing we've been looking a lot at is the importance of having a multi-sectoral approach to the fight against malaria and sort of reaching the broader sustainable development goals. And so one thing we would love, especially since Rotary it has so many members, have so much a wide variety of interests, whether it's on ag and hunger relief, to childhood immunizations, to WASH. We know you all have significant programs in the WASH space. Would love to collaborate and figure out how we could partner further on that to ensure that with WASH programs, you know that standing water provides breeding grounds for mosquitoes, which further exacerbates malaria problems. So we'd love to maybe creatively jump on, have a conversation around how we could utilize that to have a more integrated approach to the fight against malaria. And then finally, certainly, especially with Rotarians who were living in endemic countries, to really help to fight the spread of misinformation about COVID-19. As we've talked about, initially there was a great fear that people would, because there weren't proper testing and diagnostics and treatment in place for COVID early on, and hopefully that's coming online more and more, but we were very concerned that when people had a fever, they would stay home and not go to a health facility, which, like Tara pointed out, was a huge issue in the Ebola outbreak. And so we want to make sure that people are going to health clinics if they have a fever and live in an endemic country. So thank you for Rotarians helping to play a critical role in combating misinformation. So quickly, I wanted to dive a little bit more into our work in the advocacy space. We're really proud that we're a significant grassroots movement focused on the fight against malaria. We have about 350,000 supporters worldwide, but with a particular focus here in the US. We've historically really looked to partners to help build that support, whether it was faith-based organizations like the United Methodist Church or the Reformed Jewish Movement, partners like the Junior Chamber International, GlobeMed, many others, as well as creative partners like the National Basketball Association or Major League Soccer, and some celebrity influencers that we have. So we love that we're sort of a diverse array of people coming together with a common mission and goal, and we would really welcome to build out the partnership even further with Rotarians Against Malaria in this space. One of the primary things that we do, in addition to fundraising and grant making and direct support of malaria programs and some of the thought leadership and partnership work we do with the global malaria community, is our advocacy work in the United States. And so one of our core missions is to advocate to US Congress to continue to be a strong leader and funder of life-saving programs, primarily focused on the Global Fund, the President's Malaria Initiative, as well as sort of the critical role that the UN and WHO play. We also talk a lot about the importance of the research and development agenda and support to CDC as well. So as Elizabeth mentioned, the Global Fund and PMI are sort of the huge drivers of the progress that we've seen over the last 15 to 20 years. And so if we want to retain the tremendous progress we've made, whether that's the 40+% reduction in deaths, 7 million lives saved, a 60+% reduction of cases, especially in light of COVID, adding an added layer of challenge. We really need to continue to step up the fight to end malaria if eradication is our true goal, which it is. And so we're really proud that over the course of the last year or so, in the lead up to the Global Fund replenishment last October, we, working with other partners, helped to, despite all odds, very difficult political and budget environment, of course, but helped to secure a historic increase of $210 million for the Global Fund, which is, as you may know, the U.S. has a really interesting sort of a 3-to-1, well, 2-to-1 match. So essentially, for every dollar that the U.S. puts in, other countries will come and make that 3, essentially, make it whole. So the U.S. is absolutely critical, and you saw that other country, U.S. contribution and leadership is a really key leverage to bring other donors on board. We also helped to secure a $15 million increase for the President's Malaria Initiative, which was absolutely key in that, as we all know, insecticide resistance has been a huge challenge, particularly in Africa, much of Africa. And so this increase that we helped to secure for PMI will enable them to start deploying the next generation bed nets that are able to overcome insecticide resistance. And so we're actually actively working, and by the skin of our teeth, we were able to pull off our annual leadership summit, which took place March 8th to 10th, literally ended the day before the pandemic was declared. And so in that session, we have an annual leadership summit that includes an advocacy day on Capitol Hill. And so we were able to hold over 150 meetings with members of Congress from champions from 33 states across the US to raise their voices, to advocate, to say we care about these programs. We want to see an increase in continued stepped up leadership on the US front. And so we would really welcome Rotary in joining us even more in that space. We are, in light of COVID, moving a lot of things virtually. So over the course, we're starting to do bi-monthly webinars with our champions that go more in depth in terms of education and knowledge sharing, and have a number of actions lined up for the summer, whether it's call-in days, online petitions, sharing of new knowledge and statistics about the impact of these programs, and building towards in-district meetings, or in this case, Zoom meetings or calls. And we would love Rotary to join us for some of that. So how can we join forces? I've already spoke to some of these things, but we would really welcome Rotarians to join. We have what we call the Champions Council, which is essentially our leadership group of volunteer advocates, spokespersons who drive advocacy in their districts and states, and essentially express that. And it proves to be an amazing story, because you as Rotarians can say, we help to directly fund these particular programs, and we're advocating because we know that PMI and the Global Fund and other programs are absolutely critical, and we won't reach these big goals without them. So we'd welcome you all joining us, the council, for the educational webinars. We offer a lot of skills-based trainings, advocacy actions, and different opportunities, because we're part of the UN Foundation. And so we have special relations status with WHO and work at large on the Sustainable Development Goals. So I think there could be some really interesting opportunities with that. We are currently planning and hoping to hold our next leadership summit March 14th through 16th of next year, and would love a conversation around what it would look like for some Rotarians to join us for our leadership summit as speakers and presenters. We had a number of Rotarians join us a couple years ago, Steve Baker and others, and so we'd welcome expanding that even more and taking on Capitol Hill with us. Again, we'd love to, maybe we could talk about co-hosting a webinar, inviting a member of Congress to speak, a teletown hall, or different events once we are able to do in-person events in communities and states across the United States. So very much open to all ideas, and just want to mostly convey the message of, we're amazed at what you all do so far and your commitment in this fight, and would love to explore more ways to collaborate to take it to even higher levels so that we can truly end malaria. And then I think we just have a resource page, which is available to everyone. So please feel free to take advantage of some of this. A lot of this lays out some of the references and documents that Tara and Elizabeth spoke to in their presentations. And I believe there's some Rotarian references as well.
Well, thank you. Thank you to Margaret, Elizabeth, and Tara for what is a fairly sobering presentation about the dangers of the pandemic, de-emphasizing the fight against malaria. I did have some follow-up questions. I guess to start off, a number of public figures from President Andre Rajoelina from Madagascar to US President Trump have advocated the use of malarial drugs such as hydroxychloroquine for protection against COVID-19, certainly based on unsubstantiated anecdotal results. Can you explain, I guess, the dangers from a malaria standpoint of those advocates?
Yeah. So there's a lot of thoughts from a malaria standpoint, but still, I cannot reiterate enough. Please do not self-medicate. It is very, very important that we make sure people know that until the data are in and we know exactly what the effects on COVID are, but also the potential side effects and dangers, particularly with regards to cardiovascular health, until we know what those are, please just refrain. But from a malaria standpoint, so chloroquine, in case you're not familiar with it, has traditionally been very important for malaria campaigns. Unfortunately, these days we have pretty widespread drug resistance in some parts of sub-Saharan Africa, but it's still very, very important for fighting malaria in some parts of the world, including parts of Asia, Central America, and the Caribbean. And a notable thing about these areas is that a lot of them are very near elimination, so they're very near zero malaria. And a lot of them have widespread prevalence of vivax malaria, which is a particular species of malaria that can be kind of hard to detect for various biological reasons. So the problem is that if a lot of countries decide that just in case they're going to stockpile a bunch of chloroquine, or if it turns out that the Solidarity Trial or some of the other clinical trials discover that it's a useful COVID treatment, we could have a disruption of this really important drug being supplied to these countries that absolutely need it for their elimination and control efforts. So in anticipation of that, WHO and Medicines for Malaria Venture and a few partners are working to map supply chains to figure out if those circumstances do come about, how can we potentially mitigate the negative impacts, either by providing other kinds of treatment which are not ideal for a lot of reasons, including being worried about spreading drug resistance further and cost. But how can we get around these potential stockouts while still not interfering with our fight against malaria? Hopefully it doesn't happen, but we have to prepare for the worst just in case.
This is something that, Margaret, you had referenced, and Rotary Malaria Partners has recently been acquiring and distributing personal protection equipment for community health workers in select areas of Uganda and Zambia where we've worked. And that's so they can maintain their household level malaria efforts. Can you expand on what a significant problem this is currently as far as the community health workers having proper equipment and the downside if they don't get it?
I'll jump in. So it's a huge problem for health workers to not have personal protective equipment. Obviously healthcare workers in the whole world are living with some substantial level of fear at this point in time. And so it's, I think, hard for a lot of people to get up and go into work. But you can imagine that if you knew that you weren't going to have gloves, you weren't going to have a mask, and you'd probably be exposed during that time, it would be even more difficult to do so. So in order to make sure that health workers feel that they are being protected and to ensure that they're not getting sick, having gloves and masks for them when they're doing this house-to-house distribution of bed nets, and then also provision of other things like seasonal malaria chemo prevention is really of the utmost importance, not just for their own personal protection, but to make sure that they themselves aren't spreading the disease as they go house to house.
One of our subscribers commented that based on his recent observations, and this is something that both Tara and Margaret touched upon, he's seeing in Uganda already families refusing to go to the hospital to treat very serious malaria symptoms. They're worried about being mixed in with COVID-19 patients. Maybe a little about what was done during the Ebola outbreak to counter that, because that is a very large problem and difficult to overcome.
Yeah, so caused a lot of problems with access to healthcare in the Ebola outbreak, and it's been seen in other pandemics as well. It's a pretty common reaction. In the early days of this pandemic, there was also some conflicting guidance in some countries in sub-Saharan Africa where people were being told to stay home if they have a fever so they don't increase the spread of COVID, forgetting that, oh, right, that's one of the primary symptoms, most notable symptoms of malaria. And so a lot of what we can do, I kind of consider it a two-part approach. One is to educate people on just how important it is that you go seek treatment for malaria immediately, because if you wait, that's when you get some of the more severe side effects, or even some of the real severe manifestations in small children and pregnant women. But the other thing that we can do is make sure that, like we just discussed, healthcare workers have appropriate PPE, health facilities have appropriate kits to disinfect surfaces, because if we have health centers where appropriate measures are being taken to prevent transmission within these facilities, that would potentially reduce people's fear to go and seek care. But a lot of it really comes down to proactive health education to let people know that staying home is really just not an option if you live in a malaria endemic area.
Well, I think maybe just quickly, just to add to that, that we've always known that the community health worker is the absolute lifeblood of communities in terms of access to healthcare. But this just shows it that much more, because there is going to be a little bit more of a pulling effect of needing to, like, now we know in order to respect, protocols, social distancing protocols in light of COVID, having to go house to house for bed net distribution, or for RDT provisions, you really have to have health workers that can go into homes. And so to ensure that they are protected, so that people are comfortable receiving them into their homes, so that they can do the behavior change communication and health outreach. But yeah, absolutely, the health seeking behaviors, it's a huge challenge and concern, but hopefully it's something that is being addressed, but it's more expensive. We know that moving from a focal point distribution of nets to house is more expensive. It's more labor intensive. You need that much more of a scaled up and trained workforce. And so this is what you're going to end up having. Why the global funds investments have been so critical in this emergency period. But hopefully we can get on top of it.
You'd mentioned that 26 countries had been planning to do ITN, or insecticide treated nets for those who aren't familiar with the term, this year. And Tara, in some of your scenarios, I think you had indicated there could be as many as 700,000 deaths just in sub-Saharan Africa if all those net distributions don't take place. What is actually happening? Are countries moving forward? Are they postponing? What is the actual situation with planned net distributions?
So when the lockdowns started in many countries, we did start to hear that countries were postponing their distribution campaigns, and that was very worrisome. And that's part of the reason why the malaria community and the Alliance for Malaria Prevention reacted so quickly in creating new guidance, which allowed for social distancing in these campaigns. So ultimately, where we are right now, and we're tracking this on a day-to-day or week-to-week basis, is that most countries are actually going to move forward with their campaigns this year, and some may have minor delays, but right now we're looking at a risk register which shows almost all of the campaigns moving forward. We'll see how the year goes, but I think we've reacted as best as we can to make sure that that happens, and hopefully we'll be able to actually deliver on that.
Okay. Well, and with my last question, I'm going to let you wade into the political world. You both, or I think Margaret mentioned specifically, how U.S. leadership in promoting and supporting Global Fund and these other NGOs is so important. What message does it send when our administration threatens to reduce or eliminate funding to the WHO?
Oh, Jeff, you set me up. Well, let me start with the United Nations Foundation as a bipartisan, apolitical organization. No, but seriously, it's obviously of huge concern. The WHO, helps it. To cut them off now would be obviously foolhardy in light of a global pandemic. And so we're doing everything we can to shore up, in this situation, we're grateful that the Congress holds the power of the purse. And so actually and malaria is something that has always endured strong bipartisan support. It was created under George W. Bush and strengthened under President Obama. And despite this administration's efforts to cut funding to global health programs, Congress has shown significant leadership in a bipartisan fashion for support for the Global Fund and PMI. And like I mentioned, historic increases just over the last fiscal year. So I think, we believe that the U.S. Congress and certain members of the administration know that the WHO plays an absolute critical role, that they have already committed to some of, to doing an investigation at the right time, and Dr. Tedros is committed to some reforms that have already been put into place. So this is absolutely not the time to cut off funding. In fact, we need to be investing in an even stronger, smarter, more efficient WHO looking forward. So we're working to ensure that we continue to have that steady and strong bipartisan support for WHO and the fight against malaria.
I'll give you one last easy question that just came in, and that is, can mosquitoes spread COVID-19?
I can take this one. No, they cannot. Mosquitoes can spread other arboviruses. We know about a lot of them, but no, there's absolutely no evidence so far that it transmits COVID-19. And you might find it reassuring that I can't think of even a logical biological reason why it would. So it's not just that's not been tested. I think we're good.
Okay, thank you. Well, Margaret, Elizabeth, and Tara, we really appreciate your participating today. Turn the webinar back over to Ariel Delaney. If there's any other questions from our listeners, or if there's time, but with this, I'm going to turn the program back over to Ariel. So thank you all.
Thank you, Jeff. We have received a question from a listener all the way from Uganda. It says, what can we do to help vulnerable refugee women in Uganda in order to stop the spread of malaria? Malaria has been a serious killer in the refugee community, especially in urban refugee areas. Thank you.
And maybe I can address that. So through our Nothing But Nets campaign, our primary focus is on the most vulnerable populations, and much of our funding has gone towards protecting refugees and internally displaced people. And maybe I'll turn over to Margaret in a second, who's actually visited Nakivale camp in Uganda a couple of years ago due to our work with UNHCR. But I think, there's a lot that we can do. UNHCR and other humanitarian partners are woefully underfunded. We are doing work right now to try to make sure that the divide between humanitarian and development partners as related to malaria is diminished. So what we would love to see is more funding coming from the Global Fund and the President's Malaria Initiative going into refugee camps and refugee settings to make sure that those populations are protected as well. And I know that, for example, in Uganda, that has actually happened, where Uganda applied for an emergency grant to the Global Fund and provided UNHCR with funding to address the Sudanese refugee issue that was coming from the northern border. I know that it hasn't been enough. And I think we're going to constantly be strapped for resources, but I think the best that we can do is provide proven interventions to people living in malaria endemic areas where there are refugee settlements, in the same way that we do with the rest of the population, because right now there is an inequity and it needs to be resolved. And maybe Margaret, you have some comments about your personal experience.
Sure. Yes, as Elizabeth said, thank you for asking. And I did have the privilege of traveling and visiting Nakivale a few years ago. It was a really quite impressive place and really interesting because I had been in refugee camps before, but never kind of the longer term settlements. So, but I think I would just add that, we know that refugees and displaced persons often are not prioritized, and it it makes logical sense in the way that political leaders are gonna prioritize the foreign nationals or the people that have more political power and strength, if you will. So unfortunately, that does leave refugees and displaced persons out in many cases. And so that is why we've prioritized. When I talked about gaps earlier, we do see malaria prevention programs among refugees and IDPs as a significant gap. And so we have worked, to directly support and protect those populations in our targeted, small way. And have worked closely with UNHCR on that front, but I've also done a few things on the advocacy front, and Elizabeth and Tara have been working on this. We're trying to, these scorecards, if you will, we're actually talking with National Malaria Control Program officers on the need to address these populations, to identify them when they apply for grants to the Global Fund or PMI, to target, to include them in the key populations. So really to essentially have them be seen and to not be forgotten and silenced is a huge, is a challenge, but also something that we're trying to work diligently on, sort of in the advocacy and awareness front, to ensure that they are not left behind. So we want to make sure that no one's left behind in the fight against malaria, including the most vulnerable people, such as pregnant women and who are living as refugees. And actually, World Refugee Day is coming up on June 20th. And so we will be highlighting a number of stories of incredible people that we work with and champions who have experienced life as a refugee, to help to further elevate that issue and challenge, and help to raise resources and advocacy voices in support of their protection.
Thank you so much, Margaret, Elizabeth, and Tara. We actually received 3 additional questions, but we're basically at our time today, so we're going to follow up with those participants. I just want to, thank all of our speakers today, and also thank our RMP Board Chair, Jeff Pritchard, and all of you for joining us and being so engaged in this conversation. We're going to follow up with you all, again, with the detailed Q&A transcript, and we're also sharing the resources document that we've assembled with the key resources from today's event. If you'd like further information on RAM Global or Rotary Malaria Partners, please visit the websites listed. We look forward to your participation in future webinars. Thank you so much again to our speakers and to everyone who's joined us.
Thanks, everyone.
Thanks,
Take care.
everyone.